Very good morning. Today's topic is sports and medicine. This topic has been added with the sports physiology. There I am going to discuss the concept and then the sports injuries, classifications, and the management of injuries. Okay, so now first of all is the sports medicine. So there are some definition of the sports medicine according to the Philip Adler. It is the patients to medicine in the area of health and fitness to diagnose, to treat and prevent injuries resulting from sports activity. According to the Weber Dictionary, it is the branch of medicine concerned with athlete conditioning and nutrition, the treatment and prevention of athletes' injuries, and the importance of athletes' performance. Next one is the aim of and scope of sports medicine. So aim we are going to discuss. Aim is there are the four aims are there. First one is the sportsman should have the knowledge about the informations. Second one, then sportsman should have knowledge about the causes of injuries. Third one is sportsman should have knowledge about the treatment of injuries and rehabilitation of injuries. And then last one is sportsman should have knowledge about the prevention of measure of sports injuries. So this is the aim of the sports medicine. Now this is not your part, this is not your part, this is not your part. Now most I'm coming to the classification of the sports injuries. There are the three type of sports injuries. So have you seen there as soft tissues injuries, bone injuries, and joint injuries. Today I am discuss about the soft tissues injuries. The soft tissue injuries are contusion, strains, pain, abrasion, bruises. Contusion, it is a muscle injuries. Strain, it is also muscle injuries, and sprain, it is a ligament injuries. Abrasion, as someone falls or slide or on ground frictions causes layers of skin to rub off. And bruises are not clearly seen because the upper skin remain unaffected but inner tissues are damaged. This is for the soft tissue injuries. And what are the prevention of soft tissue injuries? Soft tissue injuries, first prevention I'm talking about this one. First, for contusion prevention. Contusion prevention is probably that proper warm up is essential before practice, training, and the competitions. And then conditioning should be emphasized during the preparatory period, and protective equipment should be used according to the requirement of the games and sports. And then sports equipment of good quality should be used in games and sports, and play field court should be smooth and clean. And for prevention sports injuries, and complete scientifically knowledge about the games is a must. Players should have careful and alert during the practice and competition. Good officiating qualities of official is must be preventing the sports injuries. So this prevention is applied for the all type of the soft tissue injuries you can apply. Okay. One I'm just again I'm read out one is sprain. A sprain is prevention of sprains. How to prevent? Try to avoid falling. Wear shoes that fit well, and then wear protective equipments while playing. Try to run on flat surface. Then abrasions. Prevention of abrasion is that one should try to cover the exposed skin with a layer of clothing. Don't push your body beyond your current fitness level. Learn the correct techniques before taking part in sports. And bruises, the prevention of bruises are there. The play field court should be smooth and clean. Players should not continue to play during fatigue. Players should use the protective equipments. So this is for the prevention of soft tissue injuries. Now I'm talking about the bone injuries. The bone injuries, uh, There are six bone injuries we're going to discuss. First one is simple fracture, then compound fracture, then complicated fracture, then green stick fracture, then comminuted fracture, then impact fracture. So what is simple fracture? So that we're going to discuss the what is simple fracture. Have a look. This is the bone injuries are there. So all bone injuries are like this. So I'm just going to discuss that simple fracture. Look at that simple fracture. The fracture without any wound where the bone is broken at one's place and called simple fracture. Second one is compound fracture. That compound fracture is that fracture is in which the skin and muscles are damaged along with the fracture. Generally, the broken bone come out through the skin by tearing it. This is called the compound fracture. Then complicated fracture. This complicated fracture, a bone is broken and damage the internal organ. This is called the complicated fracture. And uh, again is there that the internal organs may be tissues, nerves and arteries. Usually such type of fractures are complicated and dangerous. Such fractures are common in high jump and pole vault. Then green stick fracture. Green stick fractures are commonly seen in children because their bone are very soft and delicate. Whenever there is any stretch on the bone, it is bent. Then communicate fracture. Communicate fracture when bone is broken into three or more pieces. Bone is broken in three or more pieces. It is called a communicated fracture. Such type of fracture is possible in cycle race or motorcycle race. Okay, so this is for the type of fracture we have discussed, and now next one is a I'm talking about the causes of sports injuries. Causes of not causes of sports injuries. Next time I'm talking about the causes of fractures and prevention. So causes of fracture and preventions are there. So causes of fractures. Fracture usually occur due to the high impact on the bone. It can be causes by overused. The most common causes of fracture are given below. In sports event where there is a high impact and then forceful and unnatural movement. Second one, prolonged the long distance walking and running, then sudden fall on hard surface and the direct strike or hit with any solid sports equipments, and then osteoporosis. This is the causes of fractures. And then prevention, how it will prevent. Players should prevent adequate warm up before participating in the sports and games. All the parts of body should be exercisable. The proper conditioning must be done in proper preparatory basis, and the player should not continue to play during the state or of fatigue. Good officiating quality of official is essential for preventing fractures. Players should be very careful and alert during the practice and competition, and equipment should be of good qualities. Scientific knowledge is essential for the maintaining the bone health and preventing fractures. Protective equipments according to the requirement of games and sports should be used. Balanced diet should be taken because if deficiency of calcium and vitamin D may weaken the bones. Bone density may also decrease. The training and competition areas should be clean and hazard. So this is for the causes and prevention of then bone injuries. Now I am discuss about the joint injuries. Joint injuries, the dislocation of joint is main injuries. Dislocation of joint can occur in uh, contact sports such as football, hockey, and in sports that may involve falls such as downhill, skating, wrestling, gymnastic, and volleyball. So first joint injuries are there are the four joint injuries. First one, dislocation of the lower jaw. Generally it's occur when the chin strike any other object forcefully. It may also occur if mouth is open wide. And next one is dislocation of shoulder. Dislocation of shoulder joint may occur due to the sudden jerk or fall on hard surface. The end of the humerus comes out from the socket. Next one is dislocation of hip joint putting maximum strength of spontaneously may cause the dislocation of hip joint. The end of the femur is displaced from the socket. The next one is dislocation of waist. The sports person who participate in the sports of games in which he may fall runs the risk of getting a dislocated waist. Uh, Miscalculate landing can also cause a dislocated waist, and waist dislocated are common in various sports, that is in football, ice sports like hockey and skating. So this is for the joint injuries. Now I discuss about the prevention of this. The adequate warm-up should be performed prior of any physical activities. The proper conditioning should be done at a preparatory period. Then stretching exercise should be included in warm-up, and the player should be careful and alert during the practice and competition. Protective equipment should be used as per the requirement of the games and sports. Practice should be discontinued during fatigue. Same thing is there as a fracture. And then players should have good anticipation and concentration power. Always obey the rules and regulations. Perform regularly exercise around your shoulder, hip, waist, joints, etc. And above falls or hits are hits as far as possible. Proper physical fitness and is essential for the preventing dislocation of joint. So this is already I have discussed the bone joint. So bone joint we have discussed that bone joint, bone injuries, joint injuries, and then soft tissues injuries discussed with the prevention. So if you having any that queries, so you can discuss with me. Okay, so today's up to this much, and after this video I'm just sending some clips that will just look after. And if you're having any that queries, anything, any doubt, any confusion, you can just discuss with me now. Okay.